But that still leaves one problem. The enzyme bilirubin oxidase, I suppose, has been evolved in us as a kind of a backup so that such a problem as jaundice would never happen. Such a problem probably happened a lot in the past because there was no refrigeration, and we have always lived in pretty hot regions where mold grows rapidly. So maybe the mold problem has affected our species for all of our distant past. And we have this protective enzyme, bilirubin oxidase, so that in case the bilirubin would get too high, it could get oxidized down and not give us the jaundice. But in our jaundice cases, this enzyme is missing. Not from a mutation, I don't think, but from a toxicity effect from mercury. So we will find that this patient doesn't have bilirubin oxidase in the blood. This is the blood bottle.
So there's no protection for that patient.
There's no backup protection. The main protection is just not to have toxic metals in the liver, but that is rather hard to do. And I think really the main protection is this, meant to be this bilirubin oxidase. No bilirubin oxidase.
In that patient's saliva.
In that patient's blood.
In that patient's blood.
And it wouldn't be in the saliva either, therefore.
Right.
And therefore, the bilirubin can build up because the liver can't dispatch it or detoxify it. There it is, and remember, it went up to 8 or 9 bottles worth in the blood. That's enough to start to discolor you, make you yellow. Now, but why is the bilirubin oxidase missing? And it will be due to this metal, mercury.
Just to recap a little bit, his bilirubin on the blood test just a day or two ago was 2.4.
Yes.
And normal is 1.4. And your
Normally, the highest level is 1.4.
Right, and your normal is 1.0 because you're a bit more critical.
That's my highest level.
Right.
The norm should be around maybe 0.5 or 6.
Oh, really?
It's very carefully controlled by the body. I presume because it is really very toxic. And so when the liver has a little bit of a failure there, not being able to do it, you are notified by the blood test in the item marked direct bilirubin. Not just the total bilirubin, so you can assess whether the liver is beginning to fail this big job that it has to detoxify the hemoglobin of your blood. Your red blood cells only live for 120 days. Then they have to
replicate.
Let go of their hemoglobin. Something has to happen to salvage the iron and get rid of the globin. And this is how it's done. You make bilirubin out of it, and other parts of that whole detoxification. But here we are looking to see if there's mercury, because I was saying mercury is what inhibits this enzyme, bilirubin oxidase. And there it is, mercury right in the blood, not just in the liver or in your tissues, but circulating in the blood. That's quite high. So this person is getting a lot of mercury, even though this is a returning patient, and that mercury should be long gone.
Because he's had a lot of dental work.
Has a lot of dental improvements.
Took care of a lot of that mercury, but not all of it.
There is quite a depot of mercury somewhere left in him.
In his mouth.
And I presume that it's going to be hidden in the gum tissues in his mouth, because mercury smears all over the soft tissues and leaves you with quite a large deposit, even though you think that your mercury has been removed. The amalgam filling has been removed, but not completely. You can never completely remove an amalgam, and that being 50% mercury, my, that's very toxic. We should extract those teeth, even though we do love them very much, so that we would rather replace the filling. But if a person has any inkling that they might be susceptible to a mercury disease, they should never replace those amalgams. They should extract the tooth.
And when they drill that out, they've got a drill that runs at 25,000 RPM and vaporizes that mercury and spreads it all over the mouth, into the tongue.
It doesn't make good sense at all to drill out an amalgam. But we don't have any better way. Somebody needs to invent a better way to remove an amalgam filling. So here we have a person full of mercury, essentially full if the blood is, it shows it this much, and is going to cause him death by jaundice, which is one of the common ways that a cancer patient die.
So now we need to remove that mercury.
We need to remove the mercury, but specifically from the blood, because that is going to be too slow for us. That is going to take 2, 3 to 4 days, because first we had to give a liver set, then the heavy metals out of liver. Each of those is really a 2-day job, and we don't want to wait 4 days before taking the mercury out of the blood. We want to give him every chance to survive. So we're going to take mercury out of the blood specifically, not out of the whole body or out of the kidneys, specifically the blood. And with that mercury gone, his bilirubin oxidase will reappear instantly. If you're here, just when we see that, it'll be exciting, because the bilirubin will drop, and it will drop quite rapidly.
I'll make it a point to be here.
It will be nice to have you.